Well, I do this about 4 times a year, and this is about time to do it again. The medical system has failed us terribly. And I don't have to keep score because the government, all kinds of independent agencies, including the Center for Disease Control, the Institute of Medicine, the Journal of the American Medical Association. This came out in February of 2007, February 2007. It was a full-page news article in the USA Today. They said, each year in America, based on data from those agencies, 15 million Americans are killed, injured, and infected in hospitals and clinics. 15 million Americans are killed and injured and infected in hospitals each year as a result of medical negligence. Okay, 15 million per year are killed, injured, and infected. 2 million are infected in hospitals alone, of which 90,000 die. Then, of course, we have 15,000 seniors over the age of 65 who are killed each month. That's 180,000 a month. Or seniors who are killed by minor procedures and screening tests, like Andy Rooney from 60 Minutes. They gave him a colonoscopic exam, killed him. Look up his obituary on the Internet. Andy Rooney's obituary says Mr. Rooney died of complications of a minor medical procedure. It wasn't minor for him, it killed him. And then, of course, it killed our astronaut, our top astronaut, Neil Armstrong. He goes in, and the doctor says, oh, I just got this minor little thing going on the tip of a coronary artery. Not a big deal, not really heart attack stuff, not really chest pain stuff. But let us put a stent in, let us do a bypass, and you don't have to worry about it. And 10 years, you'll be concern-free because the stent, the bypass will prevent you from getting a heart attack from this artery. And he should have said no, but he said yes. 3 days later, Neil Armstrong, who was perfectly fit, was dead because of, quote, complications of an elective cardiovascular procedure. Elective means it wasn't even necessary. Okay, diabetes rates are going up. It's the most costly disease in America right now, eclipsing cancer cost. And, of course, obesity. We're the number 1 obese nation in the world. It tells you the government and the medical system knows nothing about obesity. It has nothing to do with eating too much or lack of exercise. It's a simple nutritional deficiency. I want you to get a hold of that book, Hell's Kitchen. The subtitle is The Cause, Prevention, and Cure of Obesity. I want you to get a hold of that trilogy of books, Let's Play Doctor, Let's Play Herbal Doctor, and the Passport to Aromatherapy, and learn how to deal with over 900 different diseases using vitamins and minerals and trace minerals and rare earths, amino acids, fatty acids, herbs, aromatherapy oils. That's the trilogy of books, Let's Play Doctor, Let's Play Herbal Doctor, and the Passport to Aromatherapy. And even if you have serious diseases like cancer, I can show you how to reduce your risk of breast cancer by 462%. Listen up, ladies. Listen up. You can reduce your risk of breast cancer by 462%, according to the University of South Carolina in 1998. All you have to do is eat your meat cooked medium rare instead of well done. You cook your meat well done instead of medium rare, it actually increases your risk of breast cancer by 462%. Reduce your risk of breast cancer by 462% when you eat your meat cooked medium rare instead of very well done. This is very simple stuff. Stay away from processed meats with nitrates and nitrites. Stay away from fried foods. Stay away from gluten. Stay away from oils. That's right. Even, yes, everybody says, well, what about coconut oil? Even coconut oil. Well, what about olive oil? No olive oil. No oils, no margarine, mayonnaise, salad dressing, and cooking oils. You take the 90 for Life program, all 90 essential nutrients appropriate for your body weight, 1 healthy start pack per 100 pounds of body weight. And you're going to do some preventive maintenance here. I've been on the 90 essential nutrients twice a day for 67 years. In a couple of months, I'll be turning 75. And let me tell you, I have not been sick. I mean, I've had a cold. I got 8 grandkids and 4 great-grandkids who snuggle with me and kiss me when they're all snooshy, you know. And so I get a cold once in a while from them. But other than that, that's it. In 67 years, I have no health problems whatsoever, 0, 0, 0. And I've been taking the 90 essential nutrients twice a day for 67 years. If everybody were like me medically, the medical system would be real humble if all their patients just visited them once every 75 years. Once every 75 years, that is even too much. The long-lived cultures, which are written up in the book Immortality, have 40 times 100-year-olds we do. They have 1 per 250 of their population. We have 1 per 10,000. And then, of course, I have a new book coming out here in just a couple of weeks. I'm very excited about this. I've seen the final cover design here now. Epigenetics is the title. Epigenetics, the death of the genetic theory of disease transmission. Boy, oh boy, oh boy. You get a hold of that book, Rare Earths Men Cures. You get a hold of the book, Let's Play Doctor, which you can do a lot of lab tests using Let's Play Doctor to do all the lab tests. And then you have the book Immortality, and now we're throwing in epigenetics, all the diseases you can prevent and reverse that are thought to be genetic that are really just nutritional deficiency disease. Oh my gosh, this book is destined to change the way that governments around the world, change the way that our government, change the way that our medical system, change the way that you think about healthcare, because this is all documented, drop-dead science. This is predictable as gravity. This information ranges everything from birth defects, congenital events, diabetes, obesity, heart disease, all the different types of heart disease, dementias, all four, well, actually 5 major dementias, and MS, Parkinson's disease, Lou Gehrig's disease. This is so wild. You can be legally blind for 6, 8, 10 years with macular degeneration. We can reverse it. Get our CDs. Seeing is believing. The medical system has failed you. It's time to give them up. We'll be back with more truth, justice, and the longevity way on Dead Doctors Don't Lie after these messages. Okay, Doug, what pearls of wisdom do you have for us today?
I thought we'd talk a bit about cancer, as I've got a story here from Natural News where they say that the headline reads, global cancer rates to skyrocket by 70% over the next 20 years as conventional medicine fails. And this is all based off of a report out from the World Health Organization. Say currently, globally, every year, this is data from 2012, they say that about 14 million new cancer cases crop up every year, but they now say that that will balloon to 25 million every year by the year 2035. In fact, there was a report out from a study done in France that also calculated a 75% increase of diagnosed cancers by the year 2030. They say that based on current trends, new cases of cancer will skyrocket in coming years. Hardest hit will be poor and developing countries undergoing major changes as a result of Western influence. And, we've seen, at the advent of a lot of these fast food companies going to these countries that are developing now, like India and Pakistan. We had some stories a while back about how their obesity and weight gain problem is starting to crop up because they're eating the same crappy Western food that we've been eating for years. They say this increase in new cancer cases is being dubbed by the UK's Guardian as the imminent human disaster. They say unless governments and medical systems make a rapid switch to focusing on prevention rather than treatment, who says the devastation that is soon to come, both in terms of unsustainable medical costs and widespread societal loss, will be unprecedented, according to the director of WHO's International Agency for Research on Cancer, Chris Wild, says the global cancer burden is increasing and quite markedly due to predominantly to the aging of populations and population growth. So if we were to look at the cost of cancers, they say that it's spiraling out of control. Even the high-income countries can't afford it. Prevention is absolutely critical, and it's been somewhat neglected. And they go on to say that not only age being a factor, but they also believe that genetically modified food organisms, trans fats, fluoridated drinking water, and other facets of modern life in North America. And they're also talking about, the mammogram, something you've talked about how they're, they want women to get these mammograms and they don't bother to warn them about the cancer that the mammogram can cost because they say, all the radiation that you get with the mammogram is enough to give you breast cancer. There's even been studies to link it to that. So once again, the mainstream medical system has failed us globally at this point.
Well, it's worth a flourish.
It certainly is. Yeah, you've been talking about this for quite a while. Don't get cancer. Eat the right foods. And
36 years have been yelling about that one. And so thank you so much, Doug, for bringing that up. Absolutely. Don't eat the fried foods. Don't eat the burnt meat. Stay away from processed meats with nitrates and nitrites. Stay away from oil. Stay away from gluten. All that will add 20 to 25 years to your life. This goes back to a big Harvard study where they looked at average longevity, county by county in the United States. They found out it had nothing to do with the difference in medical care, but the states that ate, were legendary for eating a lot of fried foods, Southern hospitality, the old Confederate states, Southwest and Texas and Louisiana. Their lifespans were 20 to 25 years shorter than the people in the Midwest, the upper Midwest. simply because they ate fried foods in the upper Midwest. The Midwest ate everything roasted, stewed, and poached. And just by cooking, you can add 20 healthy years to your life. Why not do this? Oh, I don't know. I just can't give up my fried chicken. Bam, you're dead. Well, stick with us. We'll be back with more truth, justice, and the longevity way on Dead Doctors Don't Lie after these messages. Okay, Doug, let's go to callers.
Let's head to Miami, Florida, and Gertrude, you're on with Dr. Wallach.
Hello, Gertrude, you're on the air.
Yes, hi, Dr. Wallach. I'm calling for my son. He's an 11-year-old.
Okay.
And he has ADD, where it's really hard for him to focus.
Okay.
And also, he has a mild case of Tourette syndrome. So what should I use for him?
Okay, what does he weigh? What does he weigh?
I think not about 80 to 90 pounds.
Okay, so almost 100 pounds. All right, very good. So, Char, what would you do for an ADD kid with a little bit of Tourette syndrome, ADD, and almost 100 pounds? What would you do for him?
I would get him off all sugar, and I would get him on a gluten-free diet, and then I would get him on a Healthy Start Pack 2.0.
Okay, very, very good. Good choice there, 2.0. Drop-dead gluten-free, you're exactly right. Most of these kids with ADD, ADHD, Tourette syndrome have a gluten intolerance, and they want them to maximize the absorption of nutrients. Gertrude, so you want to make sure that this child is absolutely drop-dead gluten-free. Yourself, everybody in the household, the dad, grandma, mother-in-law, dog, cat, everything's got to be gluten-free because of cross-contamination in the laundry, the food preparation surfaces, the couch, and so on. It's absolutely imperative. Then, of course, one of the Healthy Start packs per 100 pounds of body weight. That'd be a tablespoon of the OsteoFX Plus at breakfast and dinner. 1 scoop of the Beyond Tangerine 2.0 NutriCrystals, 1 scoop at breakfast, 1 scoop at dinner. And then also the 3 EFA Pluses, 1 at breakfast, 2 at dinner, so it doesn't interfere with school. And I would also throw in, if he's going to drink anything, I'd have him drink the Rebound as opposed to soft drinks, juices. As Char said, no sugar whatsoever. That includes dried fruit, fresh fruit, fruit juices. He can get everything he needs from food, from his vegetables, that he might get from fruit without the risk of the sugar contamination. But you do have to read labels, things like yogurt, ice cream, even vanilla ice cream, even vanilla shakes. When you go to these fast food places, you got to ask them if they're putting that powder in there. Usually it's barley malt, and that will set off a lot of stuff. And so whether it's from skin problems, brain problems, got to stay away from all that. Got to ask questions. It wouldn't hurt for your son to listen to that CD called Serial Killers, and Serial Killers will teach you and him and everybody else in your family. And is there any other children in your family, Gertrude, or is he the only one?
No, I have 2 more.
Okay. Well, all your brothers and sisters, your mom, and her brothers and sisters all got to get gluten-free, get on the 90, because it's something that's passed on, not genetically, through cord blood. We'll stick with us. We'll be back after these messages.
Let's head to Aptos, California, and Pat, you're on with Dr. Wallach.
Oh, Pat, you're on the air.
Yes, Dr. Wallach.
How can I help you, sir?
Yeah, I had an argument with my family the other night, and I hadn't been to a doctor in over 40 years, since 1984. So I went to the doctor. Went for a blood test, and I got the results back. And my glucose level was 102.
Okay.
And my cholesterol was 254.
Okay, that's perfectly normal. 220 to 270 is normal, so 254 is right in the middle.
Right, and the triglycerides and the LDL was 170.
Okay.
And I guess my total protein was, according to them, is out of whack. It's 8.3.
Mm-hmm. Okay. All right. Is this your urine or your blood?
That was my blood.
Okay. All right. I like to see blood protein up to about 12. Okay, as opposed to 8.3. It's a little bit low for me. Blood protein. Cholesterol, you're right in the middle. The LDL, low-density lipoprotein, considered to be the bad cholesterol, is, what should I say, it just means you're eating too many free radicals, too much fried foods, too much oils, too much processed meats, too much burnt stuff, too much nitrates and nitrites. We want to kind of shift that around. That would be great if that was a HDL, high-density lipoprotein, the good cholesterol, because we do want to stop free radical damage, because that gives you a sense that free radical damage is happening to the lining of your blood vessels, your veins, your arteries, little capillaries and everything. So it could send you in the wrong direction here. But the cholesterol at 254 is quite normal. Glucose at 102 is quite normal. And so what do you weigh, Pat?
When the last time I talked to you about 2 years ago, I weighed about 225, and now I'm down to 190.
Okay, good. How tall are you?
About 5'10.5" to 11.
Okay, excellent. 190 is about right. Okay, Shar?
Mm-hmm.
Okay, here's a guy. His blood cholesterol is right in the middle, 254. Blood sugar is about right, 102. Blood protein's a little low. But his LDL is kind of out of whack there. What did you say your triglycerides were?
Triglycerides was 170.
Okay, what was your LDL?
The LDL was, well, they have it here as 170.
Okay, so both numbers are 170. Okay, that's possible. So at any rate, yeah, the triglycerides are a little high. The LDL is a little high. So I'll just say get off all the bad stuff, no fried foods, no processed meats, no oils, no margarine and mayonnaise salad dressings. Get away from gluten, no wheat, brown, and oats. And stay away from sugar, because sugar is one of the things that actually raises your triglycerides is eating sugar, like table sugar and so forth. And hang on, Sharon, I'll be back, and we'll tell you a little program for you to get that LDL and the triglycerides in normal range after these messages. Okay, we're back in California with Pat. Shar, what would you do for a 190-pound guy? Blood sugar is 102. Blood cholesterol is 254. His LDL and his triglycerides are 170, a little bit low in protein. What would you do for this guy?
I would get him on the healthy blood and sugar pack, 2 of them, and I would also tell him to eat more eggs.
Okay, exactly. Eat more eggs, very, very good. And again, stay away from all the bad stuff, the fried foods, the processed meats, the oils, and the sugar, and 2 healthy blood sugar packs, perfect. And if you're going to throw in 1 antioxidant in addition to the 2 healthy blood sugar packs, what would you do there, Shar, for 1 antioxidant?
Selenium.
Woo, you got an AA+. AA++. Okay, very good. Selenium, 3 twice a day. It's 2 bottles a month. And then call us every couple of weeks, Pat. Let us know how you're doing. We want to know your blood sugar. We want to know your cholesterol levels. We want to know, certainly, anything else we can get, LDL, triglycerides, and blood protein. All right, Douglas, go to callers.
Let's head to Germany. And Petra, you're on with Dr. Wallach.
Petra, you're on the air.
Hey, Doc, this is Godfrey.
Godfrey.
We following our discussion the other day on the business plan.
Okay.
What I want us to treat this issue as a project.
Okay.
So we want to deal directly with you. So we want your email address and a telephone contact, because we can call from Germany on free phone.
Okay. Well, what I'm going to do is I'm going to have you hold on during the break. Okay.
Yep.
And what's going to happen is Doug is going to give you Shar's email, and that way she'll pass me the information, okay? But we'll do that over or when you drop off, but hang on. Don't hang up. You hang on, and Doug will give you Shar's email. In the meantime, when you and I are talking, she'll give him her email, okay?
Okay.
Very good. So, yeah, and we've done this in many countries. We actually have warehouses, and we're very active in the Philippines, in Japan, New Zealand, Australia. We're very, very functional. In Canada, of course, it's our 51st state. We like to say Canada's our 51st state because our neighbor. We do a lot of things together with Canada. We have business all through Canada. And, of course, it's a job because everything's fluid. Everything changes. You follow all the rules today, and 2 years later, all the rules change. You have to kind of reset and so forth. They give you a certain time period to catch up. There's no grandfathering in these instances. They just change everything constantly like a kaleidoscope. And it does present some administrative headaches, but we get it done. And so we'd just be proud to work with you and help open up Germany. And so, yeah, just get your, when you drop off here, do not hang up. Let Doug give you Char's email, and then she'll pass things on to me. All right, any other question we got, John, here, Gottfried?
It is. The problem is that the German geographical area is totally different from all these places because we have translation problem. We have to reach out to the people in their language they understand. But in other countries, you don't have this problem. So
we do. We do have the problem in the Philippines. We do have the problem in Japan. We do have the problem we do have a little bit of activity in Africa. We're in a little bit in Bolivia and also in Brazil. I mean, I only know a couple of words in Portuguese. So we do have all the farms, all the government rules, everything are primarily in their local languages. We deal with Spain and France and Eastern Canada, which is French. So everything has to be in French and Spanish. And so we do have those problems. Now, we do have a lot of tools. For instance, Dead Doctors Don't Lie. The CD is in Spanish. It's in Portuguese. We have it in, Puerto Rican Spanish and also Mexican Spanish. And we have translated it into Japanese. We have it in Chinese because there's a lot of Chinese in Southeastern Asia. We were in Thailand a little bit. And so we do sell a lot of our CDs in Chinese, Japanese, in Filipino, Tagalog, and so forth. And so we do translations. And so there's nothing wrong with getting a translation of all of our CDs and tools, DVDs, and also subtitles and DVDs, and then the books. And we're happy to deal with all that. And those arrangements and contracts and royalties and all that kind of stuff go together. And these are all international law and how these things work. Same with shipping product. We're not going to set up a warehouse and in any country and have employees and go through the machinations of all the laws of every country because somebody wants, to get the product to their grandmother. But the fact that you want to do this as a project and make this a bigger operation than just an individual thing, that becomes very attractive to us. We just have to have somebody who's responsible. Of course, you're very responsible, Godfrey, so we'll be happy to work with you. But there is a path, and we've done it many, many times, so we know this path. And so you email us and through Char and tell us exactly what we want to do, and we'll work it out with you. Okay, any specific health questions today, Godfrey?
I just want to know why people cannot drop cold turkey on insulin.
I'm sorry, say again?
Why people cannot drop cold turkey on insulin injection?
Oh, well, if they have type 2 diabetes, they cannot drop cold turkey just instantly. It has to be done by the numbers, and this is where they have to take their own fasting blood sugar every morning before they medicate themselves. And as their blood sugar drops, and sometimes it drops in 2 days, sometimes it's 2 weeks, sometimes it's 2 months, depending on their efficiency of absorption of these big molecules, these big hormone molecules. And so it's absolutely essential that this is done by the numbers, because you can go into a diabetic coma if your blood sugar goes up too high, or if you overdose yourself because your blood sugar has dropped and you're still giving yourself the medication you gave yourself when it was high, you'll throw yourself into insulin shock. So those are the reasons why, even with something as easy to manage and reverse as diabetes is, you still have to do it by the numbers to safely get to wean yourself off of insulin. I mean, let's say your blood sugar is 140, 160 fasting today, and you start a healthy blood sugar pack tonight, and tomorrow morning your blood sugar, let's say, is 68. I wouldn't take any medication, and you still keep taking your supplement program, and the next day is 72. Keep taking your supplement program, and the next day it's 78. The next day is 72. The next day is 68. And it goes on for a week or 10 days like that, and you're still well below 100 without medication. You're an ex-diabetic, and you don't need insulin anymore. But you have to do it by the numbers. You just can't cold turkey off of it, because for that first couple of days or weeks, you might throw yourself into insulin shock, or you might throw yourself into a coma because your blood sugar got too high. Well, stick with us. We'll be back with more Truth, Justice, and the Longevity Way after these messages. We're back with Dead Doctors Don't Lie on the ZBS Radio Network. Dr. Joel Wallach here for Longevity and 90 for Life Crusade. And Doug, let's go to callers.
Well, let's head to New Hampshire. And Daniel, you're on with Dr. Wallach.
Well, Daniel, you're on the air.
Hi, Dr. Wallach. Thank you for taking my call.
You bet. What's up, sir?
I'm 35, and when I was 16, I hurt my knees by overusing them. And several years ago, I hurt my shoulders and my wrist, overusing them as well. And they're injuries that just...
By overusing them, you're talking about you're laying brick or carrying lumber or chopping wood? I mean, what do you mean overusing them?
For my knees, I pulled out my first deer out of the woods about a half mile, and it probably weighed about as much as I did.
Okay.
Shoulders and wrists are work-related, repetitive, just really heavy pulling.
Okay. Very good. Okay. How old are you, sir? 35 years old?
Yeah.
What do you weigh?
144.
144. Do you have any other issues that we need to know about? Diabetes, high blood pressure, arthritis?
No, I do have really dry skin in the winter, and I've got some lymph nodes, I believe, they're hard on my neck, and they've been there for a couple of years. Okay.
Doctors aren't too excited about them?
Actually, I haven't really been to any.
Okay. Well, that's not a bad thing. Okay. Now, what I would advise you to do is get a hold of that book, Leslie Doctor, and do some lab work on yourself. Just go to the pharmacy and get the suggested kits and test strips and that kind of stuff. Do a little physical yourself. You should know your blood sugar. You should know your complete urinalysis. You should know your pulse and blood pressure levels and all that kind of stuff, okay? So give me a call in a couple of weeks for that. Okay, Shar?
Yeah.
What would you do with this guy here?
Okay, well, basically, I would get him on the Healthy Bone and Joint Pack, and he probably should take an extra bottle of glucogel and really go heavy on the glucogel to repair all those
Okay,
things.
very good. Excellent. A+. Now, Daniel, do you have any, I forgot to ask you, do you have any skin problems or eczema, dermatitis, or any history of asthma?
No, just dry skin in the wintertime.
Just dry skin in the wintertime. Okay. Let's just try it like that, exactly as Shar said. Get a hold of the one Healthy Bone and Joint Pack. Actually, I'd go for 2. 144, you're right on that cusp, and you're gradually getting more and more problems. So I'd go ahead and take 2 Healthy Bone and Joint Packs per month. That'd be 1 ounce of the Osteo FX Plus at breakfast and dinner, 2 scoops of the Beyond Tangerine 2.0 NutriCrystal that's drop-dead gluten-free, 2 scoops of breakfast, 2 scoops of dinner, 3 of the EFA Plus as a breakfast and dinner, and then the glucogel, as Shar points out, this will give you 2 bottles, which would be perfect. That'll allow you to have 15 glucogel capsules a day, 5 at breakfast, 5 at lunch, 5 at dinner. And because of the dry skin, it may be nothing, but it may be a clue that you do have a gluten intolerance. And so it wouldn't hurt to go 90 days gluten-free and just see if you notice a difference in how you sleep, what happens to your skin, bowel movements. Do you have any history of constipation or diarrhea or diverticulitis or irritable bowel syndrome, anything like that?
No, and I pretty much am gluten-free for the most part.
Okay, good. Excellent. All right, that makes it easy. Again, 2 Healthy Bone and Joint Packs. Use the CM cream where you have the most pain, whether it's your shoulder, your knees, your neck, wherever you might have the most pain. And you should expect some significant results from the analgesic or pain-relieving properties of the CM cream and anti-inflammatory stuff. You get 1 wide-mouth jar of the CM cream with each of the Healthy Bone and Joint Packs. And that'll give you some temporary relief until the repair process takes place. Again, this whole project, the 2 Healthy Bone and Joint Packs, is designed to support and promote maintenance repair of cartilage, ligaments, tendons, connective tissue, disc between the vertebrae, bone, matrix, bone itself. Give me a call in 2 weeks. Okay, Doug, how much time we got?
Got about 10 seconds here.
10 seconds. Well, I'll go ahead and take it then. I'll remind everybody, contact your Longevity associate and get a hold of that book, Immortality. Get a hold of the new book out, Epigenetics, and add 25 to 50 healthy years of your life. Even more importantly, I think, is add those 25 to 50 healthy years to your kids, your grandkids' life, your brothers and sisters, your moms and dads, aunts and uncles. We got to be proactive here to save ourselves because the medical system has failed us, no doubt about it, not only us, but on a worldwide basis. Thank you so much, Shark. Great job. Thank you so much, Doug and Billy. Superlative job as usual. God bless each and every one of you. God bless our troops. God bless our Navy SEALs. And God bless America.